done to me?
Violent and abusive behaviour against emergency medical staff often starts in the ambulance and ends up in the emergency department. That's where Jane spent the last 15 years as a nurse, saving lives in southwest England. We spoke on condition of anonymity. She tells me the pressure on services, long waits and corridor care are a contributing factor to a rise in angry attacks by patients that A&E staff are just trying to help.
My team and many nurses across the country have been victims of physical aggression, having things thrown at them. I've had a nurse, unfortunately, be pinned up against a wall.
In 89 of England's largest A&E departments, the number of incidents of physical violence against staff has increased by 94% in 5 years, from around 2,000 recorded incidents in 2019 to more than 4,000 in 2024.
We've had nurses with broken bones, we've had nurses being threatened with acid attacks. So I think the scale of some of the violence has been a real surprise, actually.
Jane loves her job, but worries younger nurses will be put off.
I'd be really worried that it would be enough to put student nurses off of wanting to come and work in wards or departments.
The Nurses' Union warning attempts to turn around the NHS will fail completely if a growing trend of abuse against staff isn't reversed.
Cigarettes stubbed out on their faces, threatened with having acid poured over them and even having guns pointed at them. A&E staff in England are facing abhorrent levels of violence, with attacks now taking place 11 times a day. That's one every 2 hours.
Shocking, isn't it? And that's according to new figures from the Royal College of Nursing, which show that violence against emergency department workers almost doubled since 2019. They say long waits and staffing problems are being blamed for increased anger among some patients.
We have been inundated with your stories this morning on both sides of the fence, from patients, from families of patients and, of course, from members of staff. And joining us now in the studio is A&E charge nurse Rachelle McCarthy, who's experienced this kind of violence for a long time, as well as Royal College of Nursing's Chief Executive, Nicola Ranger. Thank you both very much for coming in. All right, Rachelle, let's just begin with you. I mean, this is a very hard question to ask, really, but what's the worst thing that's happened to you in terms of being attacked?
So I've been in A&E for 13 years and it is a daily thing, but I've been punched in the face. I've seen terrible things happen to my colleagues. But probably being punched in the face was the most violent one that I've been.
What actually happened there? What happened? How did that unfold?
So it was fuelled by drugs and alcohol, and the male that did it, he was attempting to punch the security guard, but he'd hit me instead. So it was a full punch, as if he was trying to punch a man.
The fact that he was trying to punch a security guard anyway is not what you want, is it?
No.
And you've worked in this hospital for 10 years, is that right?
13 years I've been there.
13 years now. Have you seen, I mean, one incident in 13 years is completely not right and should be tackled at source, but have you seen the incidents increase, as these figures seem to show?
So I think they have, and I think the severity of them has, but I also think the people that are sort of carrying out those incidents are changing, the types of people that we're seeing doing it.
What do you mean?
So I think there's certain groups of patients that maybe they're facing challenges, accessing community services, there's long waits, and like you said before, you know, reasonable people that you would expect. And it's all fuelled by fear, fuelled by long waits. Would you agree? Yeah.
Absolutely.
And when we say reasonable people, we're saying these are the type of person that, not many years ago, wouldn't have dreamed of even thinking of assaulting a nurse or an A&E member of staff. But now it's becoming almost accepted practice.
Yeah, I think that's absolutely right, Richard. I think we've always had a group of patients that they're extremely unwell, they're fuelled by alcohol or drugs, or they haven't got capacity. That's probably always been a little bit of a risk that we need to manage and look after. But I absolutely agree with you. There is something that is significantly changed, I think, since COVID, actually.
Why do you think since COVID? What do you think has shifted?
I think you've talked about it this morning. There's a general incivility that we're seeing in day-to-day life. But I think particularly since COVID, we know that waiting times in A&E have gone up significantly. And actually the pressures of people in the wrong place is also an added pressure. And a key nursing skill is being able to de-escalate. If I'm honest, you can usually see someone's facial expression, then they stand up, then they start pacing. Most people don't become violent and aggressive as a switch, they build up. But if you've got too many patients in the wrong place and people are fueled by fear, it becomes a really hard place to be able to de-escalate.
This seems to be almost a British problem. I'm looking at a message here from somebody called Lisa, who's emailed us to say that her son worked in a hospital in this country for 10 years. She says he had to put up with having full bedpans thrown all over him, spat at seems to be a daily occurrence for people like you, threatened by patients' relatives for not allowing them to smoke. And last October, he moved to Australia, where he works as a nurse there. And he says it's a totally different picture. They don't get treated like that at all.
I think that's the real tragedy of this, actually. Our waiting times, our A&E departments, our general attacks against particularly nursing staff does feel like a particular problem here in the UK, actually. And I think that's the tragedy of it. 1 in 4 nurses in Australia is from the UK. We have to get this better. And we do have to believe that some of these things are within our control. Yesterday, we talked about jobs for newly qualified nurses. 2 amazing nurses who are just qualified, who still want a job in A&E. We've got to create some hope. So we've got to think we can start to get this better. But what you're describing is off the scale.
And what about punishment? I mean, the man who punched you, did he face any consequences? Was he arrested? Was he charged?
He was arrested, but there was no charges found.
There was no charge, even though there were witnesses. There were witnesses to the fact that he punched you full in the face, but he wasn't charged. Well, you see, I just wonder if that's part of the problem as well. We talk about long waiting times and we talk about the febrile atmosphere now in overpacked A&E units. But if people think they can get away with this kind of behaviour, I mean, do you think that we are too lax with these violent attackers?
I think what staff have lost faith with is we have lots of posters up and we use the language zero tolerance. But actually, it's become a little bit meaningless for many staff because we do tolerate it. And nurses are expected to tolerate it. I do think we have got to do more in that space to say, actually, enough is enough. And actually, this affects all members of staff in A&E, as we talked about, security does, medical staff, but actually, violence against staff, particularly nursing staff, are the constant presence. And actually, our report is about A&E, but it is also the ward environment, it's other areas, and the impact on individuals. We are a 90% female profession, so the majority of the people being hit, punched, spat at, threatened with acid attacks are women, and that can have a massive impact.
I also wonder, and come on to that in a moment, whether there's a general erosion of respect somehow for professionals and nurses in that capacity. But I know you met with the Health Secretary Wes Streeting. He's given us this statement: I'm appalled by the findings to your report, or the sourcing that you've done of the figures. Nurses dedicate their lives to helping others and deserve to go about their jobs free from violence or intimidation. Anyone who violates the core principle will feel the full force of the law, which is in place, actually, isn't it? It is in place since 2019. And the conviction rate is pretty good, about 80%. Not in your particular circumstance, but very often that can be a fine. And I wonder if it's certainly not working as a deterrent, is it, that law? What do you make of what he says, and what was your conversation like?
I think the Secretary of State does recognise this is an issue, and I know that the government is very committed to decreasing corridor care, decreasing care in inappropriate places, but they also recognise that this will take a little bit of time. It's taken a while to get into this mess, and it's going to take a while to get out of it. But what we do have to have is hope now.
And what about getting police in uniform there? We had a message from one male nurse this morning saying that until quite recently they had a male police liaison officer who was in constant attendance in A&E. But the Met has now withdrawn that, presumably because of budget problems, and they feel very exposed now. Surely it would be a matter of common sense particularly in hospitals, city hospitals, where this is a particular problem, to have a uniformed officer on site. Would you not agree?
It would be better if we didn't need one altogether, I would say.
Yeah.
But I think there's other things as well that can be looked at. So I think people having difficulty accessing community resources, long waits for outpatient appointments, long waits in the department, things like that are definitely factors. And a lot of this comes from fear, actually. And as a nurse, I do think we have a responsibility to be able to support those people through that fear. But some things are out of our control when we are nursing in inappropriate spaces and there is not enough staff and there are too many patients to be able to give those patients the time they need to de-escalate them.
That's the nub of it, isn't it? Because you want to be giving care in a certain way and tackling the problem in a certain way and haven't got the situation provided for you to do that. But it's terrifying.
Rachel, are you ever tempted just not to go in, to give it all up, do something else?
I love my job. And I love working in A&E, and I feel like it's a real privilege to be able to look after people in what is like the scariest day of their lives. So I worry about like the long-term retention of staff, that people will think it's not worth going in, but and it has a massive impact on people's well-being and sort of sickness. But I feel really optimistic about all of the new staff coming in, all of the new changes that have been agreed in terms of like new nurses and jobs that are going to be guaranteed. Because actually, if we can get the workforce right, we can. This will change.
Thank goodness that you were in there and fighting on, and we're all grateful for you. And any one of those people, if they saw you here now, would not believe their behaviour, I suspect, or most of them. But thank you to both of you and to you as well.
I think Rachel's an example of amazing nurses we have in this country. Despite all the violence, all the aggression, they still want to look after patients and the public.